The big idea of our group is occupational health. Our target group is university students in Hong Kong. The essential question is, what are the impacts of using smartphone for a long time on eyes, hands, and neck? Our challenge is to reduce the impact of Hong Kong university students' use of smartphone for a long time.
We chose the topic because most students have their own smartphone now. The impact of smartphone cannot be neglected. Therefore, our group thought that it is a good idea to discover the impact of using smartphone, since there is a lot of information and ideas we can find and develop. The reason for us to choose university students as a target group is because students may use a long time for researching, entertaining, or contacting with their classmates about the project. Besides, the target group can be easily found in the university in Hong Kong. This can help us save time to analyze the statistics and do the other steps.
Hong Kong Computer Society Youth Club conducted a survey on smartphone using and consumption habits of Hong Kong students in 2013. According to the findings, 90% students are using smartphones. These students, near half, spend over 3 hours on smartphones per day. Reviewing the survey results of last year, 73% of them spend over 1 hour on smartphones per day, while 38% over 4 hours. Our research has shown when people look down at the phone, his neck was a 60-degree angle, cervical heavy pressure 27 kilograms, holding a weight equivalent to a 7-year-old children. When adults upright posture, head weight of about 4.5 to 5.4 kilograms. But when people look down at the phone, his neck was a 70-degree angle. Cervical withstand the weight of the head to about 27.2 kilograms, equivalent to 1-year-old children are underweight.
Many young people often bow and pull the neck muscle when they are using mobile phones. This ultimately reduces the curvature of the cervical spine. Cervical spine bear the weight of the head, resulting in neck pain, headaches, bone spur hyperplasia, and even paralysis in severe case. Chiropractors suggest young people use the phone for a long time, resulting in phone neck, test claw, eye posture, and test neck scratching, computer vision syndrome, phantom pocket vibration syndrome. For example, there are 20-year-old teenagers extremely painful due to the neck pain and related insomnia.
There are following effects on health. First, test claw. It is a non-medical term used to describe all of the finger clamping and sore muscles that come from continuous scrolling, texting, and gaming on smartphones. And even more common side effects. Using your phone too much can cause inflammation in your tendons and enhance existing conditions like tendinitis and carpal tunnel. Similarly, cell phone elbow describes tingling and numbness in ring and pinky fingers after bending your elbow for long periods of time.
Second, eye posture and text neck. Slouching over your phone for hours at a time is ruining your neck and hurting your back muscles. Eye posture or text neck are just two of a few phrases doctors throw around to describe the excessive stress on neck muscles. According to a study of young adults in the UK, 84% of those tracked experienced back pain during the last year, mainly due to being hunched over smartphones, tablets, and computers. Fixing your posture can relieve lower back pain, and limiting your phone use can elevate neck strain. While it seems awkward, try to hold your phone directly out and in front of your face. not on your lap where you might need to look down for minutes at a time.
Third, computer vision syndrome. Staring at the tiny fonts in your texts and scrolling through dozens of tweets can lead to eye strain, blurred vision, dizziness, and dried eyes. And blurred vision plus sore neck muscles can also cause headaches. If you are experiencing eye discomfort, make your phone's font size bigger. Mark Rosenfield, OD PhD, told that phone users should try to hold their phones at least 16 inches away from their faces. Every few minutes, look up from your screen at something far away from short breaks, and don't forget to blink. Last but not least, phantom pocket vibration syndrome. A professor at Indiana University found that 89% of the undergraduates in her study experienced phantom vibrations when their phones were not actually vibrating. The study also found that students who were dependent on text messages and social media updates were more anxious when their phones were not really vibrating.
第一條問題就係你認為一日最多用幾長時間嘅電子產品最為恰當？
包括係手機或者係平板電腦。
即係根本冇一個特定嘅時間嘅 ，absolutely 冇個 time。只不過有啲研究話咧，即係長期使用嘅時候咧，有啲即係可能係啲唔好嘅後果，唔單止係 physically 啦嚇，有啲嗰個眼睛啊或者眼球啊受損啊，或者係亦都有形成一個即係一個沉迷。咁究竟幾時呢個冇一個標準嘅？睇下我哋嗰個到最後嘅時候係有咩後果？即係長期使用佢嘅後果係咩咧？咁後咧就話點有咩限制咧？限制咧就係話因為問題咧就係當真係有其他嘅嘢係受到影響，包括physical 身體啊、人際嘅關係啊，或者係以至金錢啊，或者甚至咁有損失或者有咁可能有個問題。
即係如果長時間成日都用電話啊、iPad 啊咁樣，會對可能身體會有咩影響？嗱，
好簡單咧，就係你個姿勢啦，你睇下點用法啦，咁你成日舉手又翻又成，咁低頭咁架車行撞埋你又唔知，咁啊梗係啲危險啊呢啲，即係咁你咪影響到人與人之間嘅溝通嗰種冷漠啊，成啲係呢個喺人際關係啊、心理上嘅依賴咁睇唔得、check 唔得嘅時候咧，變成個依賴。每分鐘嘅 check 一次，10分鐘嘅 check 一次嘅時候，變咗你唔使做其他嘢。
你有冇見過啲即係用得好犀利嘅嗰啲好嚴重嘅個案啊？即係用手機可能做到唔知頸椎啊。係啊，
嗰啲有問題啦，嗰啲可能要耷低頭啊，成啲咁樣。咁通常咧就話不易致命嘅咁就即係咁嘅情況啦。但係而家 so far嚟講咧，通常咧都係嗰啲咁嘅overuse 先都係即係嗰啲通常係肌肉勞損啦，或者嗰啲咁嘅情況。即係最嚴重咧，就係因為忽略咗周圍環境嘅時候咧，即係我講嘅喺呢個生理上面可能有發生意外啦，唔知踩到個氹都算啊，成呢
啲。冇得避免用電子產品，咁你覺得有啲咩舒緩嘅方法？
眼啦、身體啦、某個動作啦、某個 posture 啦，到時候咧一定要換，呢種做運動 stretching exercise， 咁做嚟所以係避免嗰啲勞損嘅現象。
咁其實政府除咗立例，仲可以做啲咩咧？對呢樣嘢？
我咩 education 啦，要靠你哋啦，咩成啦，啲 health promotion 嗰啲咁嘅嘢。
夠唔夠？即係政府喺呢方面或者其他喺呢方面。
我諗generally 大家都有個觀念嘅，但係咪積極推行呢樣嘢？政府做咧就做唔到㗎啦。好多時大家係互相嘅，你會成為一個我諗唔單止政府要 take 個 initiation 啦，咁可能 professional 都要 take 啦，尤其 healthcare professional 你知道呢樣嘢。咁當然啦，最 overuse 先仲最多就發生喺呢啲嘅書，冇辦法，因為工作關係，長期企喺書嗰啲咁嘅嗰啲咁但係呢啲嘢咧就係只不過我哋希望咧政府可以做到某一個階段咁最多好多時都係一個 public 裏邊大家個 awareness 可以做啲宣傳即係可以宣傳咁可以有啲 safety 成可以立例嗰啲，即係當然立例通常你影響到人哋嘅，但係。政府通常要立例管制嗰啲，所以中間你有個平衡。咁我覺得係一種嘅社會裏邊一個社區裏邊嗰個教育 個 promotion primary health care 咁你知道呢啲嘢喺嗰度教出嚟。一般嚟講咧就係即係嗰個 posture 啦，咁你咪有啲姿勢唔啱啊，成可能會扭親啊，可能耳氣勞損啊，因為某個姿勢成日 hold 住咁啊。
Our group have interviewed 103 students, including 59 male and 44 female. Mostly are the year 1 students. And we went to Polytechnic University and Open University to interview them. In this interviewees, most students, 34%, use their phone at home, and the least percentage, 4%, are on the street to use smartphone. Most students, 32%, use their phone less than 15 minutes averagely. Use phone averagely more than 2 hours, only have 12%.
90% of the students will use their smartphone in a dim light environment. For the posture that students use the mobile phone, 3% will bow their head to use it, and 9% will just look down to use their phone. 12% will lie down to use their phone, and 15% will use their mobile phone at eye level. And the remaining students, 61%, will use all of the postures that have been mentioned before. When the students were asked if they have the symptom of tearing or dry eye after using phone, 51% of them answered yes, and 47% of them answered no, and 12% of them answered yes, but the problem is not due to using phone. When the students were asked how long will the symptoms appear after using the phone, 74% answered that 3 to 5 hours, 16% answered 6 to 8 hours, and 6% answered 9 to 12 hours, and 2% answered more than 12 hours, and another 2% answered 1 to 2 days. When the students were asked if have they tried fingers, neck, or shoulder pain, 86% answered no, 14% answered yes. When the students were asked how long will the symptoms will appear after using the phone, and 45% answer 3 to 5 hours, 30% answer 6 to 8 hours, 90% answer 9 to 12 hours, and 6% answer more than 12 hours.
For the guiding activities, our group had made leaflets and teaching students to do exercise. For the leaflets, our group printed 50 leaflets, but still 10 leaflets left. For the exercise, we teach the students to do eyes and relative parts of the body exercise. In this, we hope that this can increase their awareness and hope that their problem like eye pain or shoulder pain will decrease.
After these few weeks of the project, I found that handle a big team of the project is difficult than handle the small team. As a group leader of this project, I divided the group into 3 teams, and all teams are well cooperated and have good communication between group mates. Each of the group have well cooperated and they can handle the work and finish the work on time. Although we are all busy, we can still take time to talk and communicate with others. And all group mates are responsible and hard work, so I can handle the project well while cooperating with them.
In the past, I finished the assignment just before the deadline. However, after I worked with my group mates, I learned not to do so. Doing something rushed is not a good behavior because the quality of product may be poor. Like this self-reflection assignment I finished 2 days before the deadline. I really learned a lot and done a lot in these few weeks and gained much sense of satisfaction.
Throughout the CBL project, I've learned a lot of valuable things. First, we have learned how to work as a team and how to cooperate well, as we must maintain a good communication or otherwise we will fail in each checkpoint. Moreover, for each meeting, it is so difficult to gather all teammates. We therefore should well arrange our time with a view to squeezing some time to attend the meeting. After the project, I have acquired a good time management skill.
I'm the first one group that will go to the Open University to do the survey. We discuss the time and the venue in the WhatsApp group. It is very convenient for our communication. Also, it can increase our cooperation through the survey.
And I learned the importance of effective communication after these 6 test points. This is the first time that I formed a group with 17 people, and I find that it's really full of challenges when cooperate with the team members. For example, sharing information and set time for meetings. It is very depends on our cooperation and behave well. We also break the team into 3 small groups and contact by the communication tools like Facebook, WhatsApp. Therefore, I think that our team is effective and efficiency. On the other hand, and I think that our team still has some spaces to improve.
I found that our teamwork has done better than before. It is because we can do our job efficiently without question and we can contact the occupational therapist with communication. Also, I can do the project easier as in our big group meeting we have a better division of work and communication. I did learn when we are discussing the interview question, I know that listen to others' opinions is important when we are doing a group project.
After these few weeks of the project, I found that doing project in a big team is more difficult than working in a small group. However, we divided into small teams and were responsible for different parts of the project. While this method is effective and makes the project well organized, I completed my own duty in the group and cooperated with my group mates.
I think the teamwork of our group is better than I expect. It is not a big problem while doing the project. Everyone has their own duty clearly and it ensures us not to confuse. I understand that everyone has their own duty and it is easier to obtain success while people work together. Communication is always an important role in the group project.
I think this is a good way for us to think about what we can learn in every week, because the guidance and questions in the checkpoint let us think about what difficulties we faced. For example, how we finalize our questionnaire, like the details and the answer in the questionnaire, and how we can create a good questionnaire.
During these weeks, I have learned a lot, including communication, collaborative. It is really hard to work with and talk to 70 people. However, I'm glad to work with these people. They are very nice and responsible.
When doing the project, our group have divided the job equally and efficiently, and we are getting more and more information and data which help us to make an effective solution towards the issue. It makes our project go smoothly. Besides, the bond among the groupmates becomes stronger and stronger. I feel happy to work with them.
For these weeks, I have learned to make the questionnaires question to be more accurate. Although it is hard to have all group mates in such a kind of group to attend a meeting, but we can share information of the meeting for our group mates through different ways such as smartphone apps, Google Drive, and etc.